It is one of the reasons that I went into urology, and it's mostly because no one likes to talk about bladder issues. It's not something that we're comfortable with. It's not something that we want to share with our neighbors, with our family, but at some point it affects a good number of us. And that's what we're going to go through tonight. So we'll get started. So to start with, did you know 44% of people say that they are embarrassed to talk about bladder control issues? And I think the reason for that is sometimes, one, it's a personal embarrassment, and they don't think other people share these types of experiences. But common things I hear from my patients are, am I ever going to regain control again? You know, this is limiting me from doing the things I enjoy. I can't date. Can I go on a picnic with my family? How would I get through a job interview? How would I sit on a plane? But these type of things are often what prevent people from asking us or even their primary care doctors. And because of that, they don't really know that there are options to treat bladder control issues. And so again, that's what we're going to focus on this evening. And hopefully by the end of the talk, you'll have a little bit better understanding about why the bladder does what it does, where its inconsistencies, what causes those things, and also what options you have. So we'll start with understanding bladder control. What's the definition? We're going to go through the care pathway. So as far as diagnostics to figure out what type of bladder issues you're having, different treatment options. And then specifically tonight, we're going to focus on two technologies, including the Medtronic InterStim systems and also tibial nerve stimulation. We'll have plenty of time for questions and answers at the end. So the first huge point is not only are 44% of people afraid to talk about this, but that this affects 1 in 6 adults. And you'll see this term OAB. OAB is overactive bladder. And so what we know is that this is more common in the United States than vision problems and even diabetes. You'll see at the bottom of the screen there, 30 million adults in the United States have diabetes, while 37 million adults are dealing with overactive bladder issues. This affects men and women. It is more common in women, but like I said, affects both. And it can affect all ages. So I treat 14-year-olds with these problems. I treat 90-year-olds with these problems. And it can lead to a very negative impact on your quality of life. For example, if you're having to wake up to use the bathroom multiple times at night, you're not sleeping, it's hard for you to focus, you have a loss of confidence, so you may not be interacting with your peers or your family as much. That can lead to self-esteem, even depression issues. I've had a lot of patients who, especially during the pandemic, you know, not only are we not getting out as much, but they're afraid to go to the gym or even walk around their neighborhood because they're not going to make it around the block without needing to use a restroom. So now we're not as healthy because we're just not as, exercising as much. So it really can have a negative impact. It starts with the bladder, but it can affect all parts of our lives. Sorry, I'm just switching slides here. So what's normal, what's not? And I will say, I will talk about this and please understand there's a wide range of what's normal, because I have some patients who feel that normal is only urinating twice a day. As a urologist, I can tell you that's not normal. But I also have patients who may go 12 times a day, but it's better than the 30 times a day they were going before, and that's acceptable to them. So I'll sort of give you a range of what we consider to be normal, but just know that a lot of this is dependent on how much the patient is willing to accept. So on average, over the age of 40, it is normal for a male or female to wake up once at night. And in the daytime, I would also say on average, going about 6 to 8 times a day is fairly normal. Your bladder also should be able to give you enough time, enough signal that you need to go and you can get there in time. However, with overactive bladder, what we're seeing is people are going more often than that. They're having to plan their activities around the bathroom. So for example, my bathroom mappers, you're going to HEB, you go before you leave your house, you go at some point before you check out, and then as soon as you get home. I also see patients who unfortunately are quite dehydrated because they really are fearful of drinking too much. They get urinary tract infections, maybe even kidney stones, just because they're limiting their fluid intake. The other thing is, we're really compromising our quality of life in that we're having to wear pads or garments to help control our leakage. So again, everybody's different, and what you're willing to tolerate is different than others. But I will tell you, this is not normal. It's not normal for any age, and there are many treatment options. So we'll get into that in just a second. So next, we're going to talk about basically the urologic system and the coordination that requires for you to successfully empty and control your bladder. So it starts with your kidneys. Your kidneys are filtering fluid all the time, producing urine. So it's not a start-stop, but you're always having urine produced by the kidneys draining to the bladder. When the bladder is about halfway full, it should send a signal from your nerves up to your brain, and then it's signaling your brain, okay, it's time to start looking for a bathroom. So then your brain is always telling the bladder, don't go, don't go, don't go, until you consciously override that. You say, okay, I'm in a safe place, pants are down, now's a good time to go. So whenever there is a disconnect between bladder, brain, or even the nerves down low, this can cause an issue with you being able to control your ability to empty and get there in time. So what kind of things in our daily lives or our medical history can cause these problems? So we'll start with daily habits. Pretty basic stuff that a lot of you are probably familiar with. Caffeine is a bladder irritant. If you're drinking 4 cups or 4 sodas a day, it's probably too many. I generally tell people stick to 1 or 2. Keep it mild to moderate. Alcohol is a diuretic. So even your evening cocktail, which maybe some of you are enjoying right now, could cause you to urinate more frequently because, again, it's a bladder irritant and a diuretic. Also, for some people, there can be certain bladder irritants in foods. This may include spicy foods, more sugars, acidic foods, those kind of things. Certain medications, if you're on blood pressure medications that are diuretics, supplements can sometimes irritate the bladder. Things like pregnancy, where you see hormone fluctuations, childbirth, anything that would involve a pelvic floor injury, that could include a lower spine injury, a sacral nerve injury, that all affects signaling to your bladder. There are a couple other medical conditions I wanted to highlight because they're fairly common in our population. One is diabetes. Basically, just like diabetes controls and affects, I should say more, like the nerves to your eyes, your hands and feet. In fact, it can cause what we call peripheral neuropathies for people. It affects the nerves to your bladder. It can cause a bladder to be spastic and overactive. Sometimes it can even cause a bladder to where it doesn't empty all the way. Other things are the sugar in your urine. If you're spilling a lot of glucose in your urine, it can irritate the bladder, make you go more urgently, more frequently. Other neurologic conditions that can affect the bladder, Parkinson's, multiple sclerosis, stroke. And again, I go back to it requires this signal from your bladder to go up to your brain, and then your brain to inhibit things until you're in a safe place to go. So if there's a disconnection, whether that's caused by a spinal cord injury, stroke, Parkinson's, any of those things can cause us to have difficulty controlling our bladder. So we're going to split it up into 3 different types of bladder control issues. The first will be stress incontinence, the second, urinary retention, and the third, overactive bladder. So stress incontinence is the type of leakage we experience when we are active. So for example, I cough, I sneeze, there's an increase in my abdominal pressure by doing exercises, laughing. Basically, that increase in my abdominal pressure is higher than the pressure of my little Kegel muscle to close. So like a leaky valve, it just comes out. And the correct way to treat that type of incontinence is basically to strengthen that barrier, those pelvic floor muscles, the Kegel muscles, if you will. And so that can be through certain surgeries or even through pelvic floor strengthening. So the second one is one that is probably more common in my male population, but I see it in my females too. So this is urinary retention. So urinary retention is basically where you're not getting the right signaling to know your bladder is full, or there is blockage of your bladder and you can't get it out. So the problem with this is when folks have a bladder that gets too full and they can't empty, they leak. It's like the tea kettle that got too full. Those folks sometimes respond to medications. Sometimes they have to use a catheter. Or for example, for men with enlarged prostates, sometimes we have to open up the area of the prostate. Sometimes this is a neurologic issue, and it's basically where the nerves aren't sending the right signal to generate an effective contraction from the bladder. So sometimes we even use sacral neuromodulation to help wake the bladder up, like a pacemaker, to help folks empty. The other thing that we see with this type of leakage is sometimes patients have really no idea that they're not emptying all the way. So this is something that unless you see a urologist who can ultrasound your bladder and help figure that out, it may not be real clear what the main problem is. So the third one is overactive bladder, and that's the treatment that we're really going to talk about tonight. So overactive bladder is basically, like I said, your bladder is supposed to wait till you give it the signal, I'm in the bathroom, we're good to go. But what's happening with overactive bladder is your bladder is acting with a mind of its own. So you have to go more frequently, more urgently. You're sort of always aware of your bladder and you feel like you could always be in the bathroom. The other thing is it will cause you to leak. And it's the type of urgency, not coughing, sneezing, not because it's filling up too much, but it's basically your bladder squeezing or contracting before you tell it to. Sometimes there can be triggers for that. My patients will tell me, oh, it's as soon as I open the front door or I hear water running. But this is the type of leakage you don't really know when it's going to happen. So it's really debilitating to one's quality of life. Because at least if you leak with coughing, sneezing, you can prepare, or at least kind of get to an area where you can protect yourself. With this one, you have no idea. So it's really quite embarrassing. So the good news is there are great treatments. I love this slide because she looks very happy. So we're going to find out what those treatment options are and why this nice lady looks so happy here. So basically, to diagnose overactive bladder, the best way is to come in, see a urologist. We can go through your history, your symptoms, and then do some minimal tests in office to help make sure there's nothing else contributing. Also, we can look at your current medications, other medical history to better help you figure out if overactive bladder is the right diagnosis. And if not, we'll figure out what it is. So the modifications to your lifestyle can make a difference. There are oral medications. And then for folks who don't respond to that, there are advanced therapies. And we're going to go through each of those. So lifestyle changes. And I will say everybody is different. I have some patients who come in and they say, I prefer to do a natural approach. I have others that say, show me a surgery, I want this fixed tomorrow, and anywhere in between. So we'll start less invasive and work our way up. So Lifestyle changes are going to be simple solutions that you can implement into your normal routine that may make a big difference. So diet, for example, we talked earlier about caffeine, alcohol, sugar-based foods. If you can eliminate things that irritate the bladder or are diuretics, that's helpful. For nighttime, try to stop most of your fluid intake 2 hours before bed. Exercise. Any exercise will help, but especially the things that are going to move your hips. So walking, swimming, biking, if you are comfortable and understand how to do Kegel exercises, that will help. And I would encourage you, like when you get the urge to go, if you can do a Kegel contraction, it sometimes will help the bladder muscle chill out, give you just a little bit more time to get to the bathroom. Bladder training. So the problem is a very strong connection forms between the bladder and the brain. And so with these triggers, even if you think about, oh, I'm going to go to bed, I hope I don't wake up a lot to urinate, then all of a sudden your brain is involved and you've urinated 4 times before you can fall asleep. So basically, it's a method of distracting yourself, knowing your bladder can hold more. You just have to be a little bit more in control. So I would tell folks, start these exercises at home. Don't do it when you're out in public, because if it doesn't work, you may leak. But basically, you want to tell yourself, okay, I'm getting the urge to go, but I'm going to wait. I just went 20 minutes ago. Surely I don't need to go. And I would say on average, we produce about an ounce of urine an hour, so 30 cc's. It's not very much. You're waiting till your bladder gets about halfway full. So, 200, 250 before you really need to empty. So distract yourself. So I'm going to wait 5 minutes, then try to go to the bathroom. And with time, you will be able to increase that interval. The final thing there is pelvic floor strengthening. Those were the Kegels we mentioned. And so that is something that if you were going to get in a routine to do that, it can be very helpful, especially for things like the stress incontinence, where you're trying to strengthen those pelvic floor muscles, where you don't do coughing, sneezing type leakage. Okay, we're going to move along to oral medications. Oral medications have been out for a long time for overactive bladder, and I will say they help a large number of our patients. The only problem with oral medications is these are something you have to do daily, so you have to be consistent with them. They don't work very well if you just do it intermittently, because they take a little while to get in your system. And there are several generations of these medications. The older, more traditional ones can cause side effects like dry mouth, blurry vision, even constipation. And unfortunately, there are studies that showing some of the older anticholinergic medications that they can put folks at increased risk of dementia. So when folks have been on these a long time, or they have other medical issues, that may interfere with taking this type of medication, we try to stay away from those. Some of the newer medications for overactive bladder, like I said, they also are successful for a number of patients, but there is a slight risk of increasing blood pressure. Now, we do know the compliance, the ability to stick with taking a medication consistently is tough for some patients. One survey showed 72% of patients stopped taking a bladder medication, and it's probably because of potential side effects they may have encountered, or again, they just weren't thrilled with taking another pill. So moving down the line for medications, these are what we call our advanced therapies, or our third line treatment options. And this is when you've tried lifestyle changes, you've tried at least one medication, and you really haven't had the improvement in your quality of life. And where I would tell you is, if your symptoms are at least, if they're not at least 50% better, move on, or at least consider one of these options. So the 3 we're going to talk about is Medtronic InterStim, that's the sacral neuromodulation, PTNS, tibial nerve stimulation, and Botox. So Botox is a procedure that is very popular. It's something that can be done in the office. Sometimes we do it in the operating room. And this is not going to affect nerves, but it's going to influence how the muscle of the bladder works. So basically, we're injecting a small amount of Botox through a camera, a cystoscope, diffusely throughout the bladder. And what it's doing is it's telling the bladder to sort of relax. The thing with Botox is it works fairly quickly, but it's not going to last forever. So on average, it lasts about 6 to 9 months. We do have to be cautious with the patients we use Botox in because it does have a slight risk of increasing someone's ability to go into retention, just meaning that maybe it worked too well and their their bladder is not able to empty completely and may require them to use a catheter. So again, it lasts about 6 to 9 months. One study has shown that due to probably the compliance or the need to continue with having to do this routinely, is that about 51% of patients have stopped after 2 treatments. But again, for some patients, this is a good option. So now we're going to move to the category of nerve stimulation. So we'll start with PTNS, and this is a tibial nerve stimulation. So this is not a surgery. It is a procedure done in the office. And basically what it's doing is it's a tiny needle is placed in an area near your ankle, and it's stimulating the tibial nerve, which communicates to your sacral nerves, the ones controlling your bladder. It's going to work on improving urgency, frequency, waking up at night, and that type of leakage, the gotta go. So this is done initially over a 12-week period. So you come into the office, it's a 30-minute visit with the nurses, and then you're there, you read a book, check your phone, and then you're here for 30 minutes. If you have at least 50% improvement, which most patients see 60 to 80% response, then you would follow up and you would continue to do it as a maintenance therapy on a 4-week basis. I think the most difficult thing for patients with this one is just scheduling. But again, it's a very good option for patients who have the time to do it and also perhaps aren't interested in something, more invasive. I will say this is not acupuncture, but a lot of times we describe it to patients as being similar to acupuncture, just as far as it's a very tiny needle that we use, and we are working on a nerve stimulation there. So now we're going to move on to sacral neuromodulation. So the best way to describe this is your sacral nerves, your S3 nerves, are the ones that control your bladder and your bowel. So what I am doing is I am placing a tiny lead or electrode that is sending a continuous stimulation to the sacral nerve. So again, very similar to what we were doing with the ankle on the last slide, but this is going to be a continuous stimulation that's working all the time. And I tell folks, it's not telling your bladder to speed up. It's not telling it to slow down, but it's telling it just to work correctly. And the reason I emphasize this is because this is an important treatment for folks who have terrible overactive bladder, urgency, frequency, waking up at night, gotta go leakage. But in the same respect, this is also very helpful for people who have non-obstructive retention. So this is the type of people who there's no blockage of their urethra or bladder, but they just can't empty. And so this helps to sort of wake the bladder up. I liken it to a bladder pacemaker, if you will. It's just a lot easier to put in than a pacemaker. And there have been several advances in this technology over the past year, making it more desirable for patients. One of those is that there now is a rechargeable battery option. So basically, the rechargeable battery is good for 15 years. It's quite a bit smaller. As you see on the slide, it's the one shaped like a rectangle. And then the battery next to it is still a good option. And that one is non-rechargeable. So that's a great option for someone who just doesn't want to have to worry with keeping up with recharging something. And how often would you have to recharge it? It's about 2 times a month. So how do we figure out if someone, is a good candidate for InterStim, and how exactly is the testing process? Because I have some patients that are a little hesitant, saying, oh, you're kind of putting in hardware and Now we're talking about surgeries. But I want to dismiss some of those fears because this is a test that can be done as a trial in the office or in the operating room. And it's just a trial. So you do it in 2 phases. The first test is where the lead is inserted and it's taped to your back. If it's done in the office, then it's taped to your back for about a week. If we do it in the operating room, which is the way I usually do it, mostly because I see about a 20% increase in a patient's success rate, I'm using X-ray. And in the operating room, it's not generally anesthesia, but it's done under sedation. And so again, it's taped to your back. And then we give it about 10 to 14 days to see how well you respond, supporting you the whole time. If you have at least 50% improvement in your symptoms, whether that be overactive bladder or incomplete emptying, then we move on to placement of the battery. And again, you've got the rechargeable and the chargeable options. And I should have mentioned those are also MRI compatible. So you can kind of do whatever you want. You can get MRI, CTs, you can swim, you can travel, all of those things, just to get back to your normal quality of life. The efficacy of this is quite high. 84% satisfaction among those who proceeded with InterStim. They noticed 3 times greater improvement in quality of life when compared to medications, because all of these patients started with medication and then moved on to this step. We also see that 76% of folks achieve success with this technology, sacral neuromodulation, when you compare it to only 49% of patients who had success with the medications. So I've talked about a lot of options. Some of you have experienced these things, and so you already are thinking whether this, which of these techniques would be a good treatment option for you. I think the folks who benefit from InterStim the most are ones where there is at least moderate to severe bother in their symptoms. It's affecting your quality of life. You failed lifestyle changes. You failed at least one medication, and you're still finding that your bladder is controlling your daily routine. If you're at that point, it's time to do something more. I also think that it's probably one of the only good options for people who have non-obstructive retention. So if you're someone who cannot empty your bladder all the way and you've failed medications, using a catheter is not desirable for anybody, then InterStim is a really good option for that. One thing I didn't highlight earlier is that this also is approved by the FDA for fecal incontinence, so bowel control. While I am not a colorectal surgeon, I have had a lot of patients who have both bladder leakage and fecal incontinence. And this is the only technology that will address both issues. You place the device in the exact same location and it improves both issues. So I think that's a really good option because about 30% of folks who have overactive bladder issues also will have fecal incontinence as well. So this was a little video I'm going to exclude just because we got started a little bit late with our technology error, which I blame internet in our office. So anyways, we're going to move on to questions. And it may take us just a second to see your questions pop up. So if you have a question, feel free to type it in. We're going to take a look and then we'll address those. Thank you, Ms. Miller. Got some positive feedback from Ms. Miller. Appreciate that. I have a list of some frequently asked questions that we can kind of go through as well, just if someone wants to know more about that. I will tell you the InterStim, that's one that came up earlier, has been around 23 years. The battery life on the InterStim, like I said, the rechargeable one is about 15 years. The non-rechargeable one That one you don't have to do anything with. Once it's in, it's in. And that's good for about 3 to 5 years. With respect to overactive bladder, a common one I get is what can cure this problem? I'm gonna be honest, this is not a problem that will be cured. You will need some type of treatment, and that treatment needs to be ongoing, whether it is a medication, physical therapy, maintenance of your nerve stimulation, or Botox. It is something that you have to persist with, or the symptoms will come back. Again, I said MRI compatible. InterStim is MRI compatible, where it wasn't a couple years ago. Are any of these things painful? I would say Botox, we do under sedation in the clinic with a little Xanax or nitrous. We numb the lining of the bladder. Most patients are quite comfortable in that setting. Again, when we do the InterStim, we are doing it under a heavy sedation, so it's not generally anesthesia, but it also is something where you're not feeling anything. And once the device is put in, it's not a shocking sensation, but it's sort of, people describe it as like a slight tingling or fluttering sensation that folks easily, get used to. And then again, I think I mentioned earlier that this is very useful for fecal incontinence, one of the only technologies that covers both bladder and bowel type leakage. I think we had a question pop up, so I'm going to tag over. Good question. So basically, is the ultrasound or a sonogram the only way to check for retention? So there are a couple things you could do at home. So let's say, you drink about 1 liter to 2 liters of fluid a day. You can kind of estimate that you should be producing about as much urine as you're intaking. So if you had a way to measure your urine output for 24 hours and you saw you were getting at least 1 liter out a day, I'd say that's a fairly good indication you're doing okay. In the clinic, and some primary care doctors have this as well. We just do a little ultrasound over your bladder after you empty to make sure that that number is adequate. And then another way to do it, which is the most accurate, is to actually place a catheter and drain the bladder completely. A CT scan, it will indicate if the bladder is full when the CT scan is done. But it could be, it could be because you just had a lot of fluid, or they didn't give you enough time to empty your bladder before the CT scan. So that may be a little bit misleading. Okay, moving on to just another question. Oh, this is a really good one. Okay, so basically the question is, if you have a patient who may have some cognitive delays, whether that be mental disabilities or dementia issues, does InterStim work with that? It does. And I will say that I have helped quite a few patients with dementia. They always have good support from family. So I do think that's very important for this to be successful. But I kind of talk to the patient and we explain to them what we're doing, but they're not going to have discomfort when we place it because it's under heavy sedation. And the most important part for me is afterwards, when it's taped to their back, that we explain to them it's just a bandage and we're going to leave that bandage alone. But as far as, does the patient themselves have to do much with controlling it or changing the settings? Not at all. If you have a supportive family member, and we always encourage in recovery after the device is placed, a rep will meet you there, and I will be around as well. But it's basically for us to show you how to use the little remote. It's pretty simple. It's like a TV remote. And basically you have different channels. So you can adjust the setting. And you also have a volume, if you will, so you can turn it up and down. So we would help with that. So the patient themselves doesn't have to be particularly in control. But I would say family support is probably the best way to do it, just so it can teach you the nuances of the device. The other second part to that question was, what do you do during the trial if you have an active job? So let's say you work at a grocery store and you're having to lift things, or you work outside and landscaping, those kind of things. The most important thing during the trial is that you don't get the lead wet. So we want to keep it clean and dry. Again, it's taped to your back, and we can change those dressings out in our office as we need to. The other thing is, while you can move, you can walk, you can drive, we don't want to risk that device getting pulled. So I would say you have to just be cautious during that trial period. Once the battery is in, nothing is outside you. It's all under the skin, and you can do really whatever you want to do, which sort of leads us to our next question. What are my limitations if I get the device? Okay, scrolling down here. Not many. It used to be, I told people you couldn't get an MRI, or I should say this, it often was not approved by the radiology centers to get an MRI with the older device. With the newer device, you can get MRIs, you can get CT scans, you can, like I said, you can swim, you can hike, you can travel, you can go through airports. So really no limitations there. During the trial period, of course, like I just mentioned, we want to limit your physical activity to some degree, nothing really strenuous, and we can't get that wet. But once the battery and everything is tunneled under the skin, you can really do what you want to do. I have patients who ski, you can really live as active of a lifestyle as you want. Does this work for men as well as women? Certainly. Overactive bladder is a more common problem for women, but we treat a fair number of men. And these are men that probably started with treatments of their prostate. Perhaps they had some blockage from an obstructed prostate that got opened up, but now they're having terrible overactive bladder issues. The reason for that is the bladder itself, with years of having to push through a big prostate, it makes the bladder muscle thicken. Just like if I was in the gym, I won't show you guys my biceps because they're not real big right now. But yeah, if you were in the gym and your muscle is getting thickened, you can have basically these spontaneous spasms or contractions. So I see a lot of men with this problem. I also see men who have issues with the non-obstructive retention. So where bladder got so stretched out, it just doesn't want to work now. And so this is a really good option in that setting. How long is the recovery? So basically, I apologize, my screen keeps flipping up. Okay, here we go. So the recovery on something like this is, I tell people, with the initial lead placement. So during your trial, the way I do it, like I said, I do it in the operating room so I can use X-ray and more accurately place the lead. So you're looking at about 10 to 14 days of a trial where we just don't want you doing anything super strenuous. You can work, you can go to work, you can drive, you can do a desk job. I wouldn't be a rodeo clown that week. But after the second surgery, once we put the battery in and everything's closed up, it's just within that first week or two that we don't let you get it submerged. So we don't want you in a swimming pool. We don't want you in a hot tub, but you could shower during that period. And then once the skin incision is closed up all the way, which usually just takes a week or two, depending on how well a patient heals, you can do whatever you want. Thank you, Mr. Wellhausen. Okay, any other questions? I'll pause for a minute just to see if something pops up. Again, I thank everybody for hanging on with our technical difficulty. And if it's something you're interested in, or, other bladder issues, feel free to call us and we'll help you make an appointment. Again, the evaluation office is fairly easy. We want to make sure your urine looks good, no infection. We want to make sure you're emptying all the way. And then we can kind of better help guide you as to which of these things would be most beneficial. Okay, I think that's it. Well, thank you all. Have a lovely weekend. I'm going to take my kiddos to the beach tomorrow. So pretty pumped about that. And I will see you here in the office. Okay, take care. Have a good night. Well, how do I act? That's what I do. Okay. See you, everyone. Take care.